Good evening, everyone. My name is Carla Deal. I'm ACHA's Peer Mentor Coordinator, and it's my pleasure to welcome you to tonight's ACHA webinar, Coping Skills to Live Well with CHD. We're so excited to have so many of you here with us tonight. I'd also like to thank Abiomed and Johnson & Johnson for their support of this webinar through an unrestricted educational grant. As a friendly reminder, the webinar is being recorded and will be available to watch again later this week. We will take questions and comments throughout the presentation, and you can send those through the Q&A folder on your control panel. We will answer them after the presentation. We ask that you keep your comments and questions general and remember the webinar is being recorded. Our speaker cannot answer questions or make comments specific to your CHD diagnosis or treatment. Those questions and comments should be discussed with your ACHD team. Since we do have a very large webinar tonight, if we cannot answer your questions, please reach out to your ACHD team. Closed captioning has been enabled. If you wish to use it, click on the Show Captions CC on your user panel. You can also disable that at any time. With that said, it is my pleasure to introduce our speaker this evening. Tracy Livecchi is a licensed clinical social worker and has been working as a psychotherapist in private practice since 1997. She has worked in a variety of settings as a private therapist, clinical director, and consultant for long-term care and hospital settings. Tracy has a special interest in working with individuals dealing with serious and chronic illnesses. Since 2009, Tracy has been the mental health consultant for ACHA's Peer Mentorship Program. You can read her full bio on our website at www.achaheart.org. It's now my pleasure to turn the webinar over to Tracy Livecchi. Tracy, the floor is yours.
Thank you so much, Carla, for that introduction, and thank you all for coming tonight. I'm going to be talking tonight about coping and giving some evidence-based strategies for living your best life. Next slide, please. So a quick disclosure, I will be referencing the book Healing Hearts and Minds throughout the talk, and there might be a few quotes as well from the book. And I wanted you to know that I am a co-author of that book. Next, please. And a quick disclaimer that tonight's program is really for educational purposes only, and it's not to be interpreted as specific advice for your individual mental health situation, and it should not replace any kind of professional advice. Next, please. So I always like to share this graphic with people just as a reminder of the interconnected relationship to these different components of who we are as people. So what affects us biologically or physically really does seep into our social life, our emotional life, and our psychological life. And I say that because I really encourage all of you to check in with yourself and to take a look and ask yourself, how am I doing in all of these areas? Next, please. So what are these challenges that we need to learn to cope with? Well, I can tell you that as adults, whether you have a congenital heart condition or not, there are stressors in life, right? We have to pay our rent, we have to pay our mortgage, we have to figure out, what we're going to do and how we're going to spend our time and who we're going to spend it with. And the thing is that when you have a congenital heart condition, there's a whole nother layer of stressors that may or may not really need to be coped with. And this particular slide outlines some of them, not all of them. You might have experienced others that are not in the slide, or you might be thinking, oh, I haven't really dealt with any of these, and that's totally fine. But these are, like I said, just some examples. I know I've dealt with a few of these challenges, and some of the people that I work with have as well. So I think it's important, I'm not going to read all of them, but I think it's important to know that whatever you've gone through as an infant or a child or a teenager, those experiences can follow you into adulthood. They don't have to, but they might. And as adults, as we move into the older ages, there are other challenges that we're going to need to contend with. You might be dealing with ongoing cardiac symptoms or repeated hospitalizations. You might be dealing with maybe finding a job or trying to secure some good health insurance. Maybe you're dealing with some challenges of family planning. And I know for me, aging now, I'm starting to think about different changes in my body and how my congenital heart disease may or may not progress. Um, so these are just some things just to keep in mind, and this is really what we're going to be coping with, right? We next, please. So the most important takeaway here is that everyone is different, and what I may have experienced, you may not have experienced. But that there are some normal reactions to some of these challenges. You might have experienced some feelings of anger, sadness, or feelings of loss and fear. And I want you to know that a lot of these reactions are completely normal, and they don't necessarily have to mean that there's a diagnosis or a disorder. Next, please. On the other hand, though, I do think it's important to just let you know about some of the research. So, some of the research does put adults with congenital heart conditions at an increased risk of developing a mental health um, disorder. So, one paper found that we have a 50% lifetime prevalence of developing depression, anxiety, or PTSD. Does that mean you're definitely going to develop this? Absolutely not. But there is a 50% chance, and that is significantly higher than the general population. Another paper found that of people who could have really benefited from mental health treatment, 69% of them were not in any treatment at all. And this other paper found that mental health disorders are underdiagnosed and undertreated. So I just bring that up to, raise everyone's awareness and to let you know, I don't know about in your experience, but in my experience, I found resources to be really limited. And I think that if you feel like you need some support around these issues, reach out and ask. Ask your ACHD center, who do you have that you can refer me to help talk about some of these things with me? Next, please. So I came up with this little acronym that I really like, which is ACT. And the A is basically about acknowledging or increasing your self-awareness. What is it that you're feeling? Have you experienced any of those challenges? Have you had increased stress? If you have, what is it about? Is it about your congenital heart condition, or is it just about life in general? What are some of the psychosocial issues you might be carrying? The C is for coping. I really suggest that everybody take a look at how you cope with your stress. What are the strategies that you're using? Some of them can be really helpful. Some of them may not be, though. Some of them may be unhelpful. And I want you to evaluate that. What are some of the unhelpful ones? Well, the use of drugs and alcohol, and that can include prescription drugs, maybe narcotics or benzodiazepines. It could also include maybe some isolation or avoidance. Um, those are other things that you really want to try to lessen and add one or two healthier or more helpful strategies to your plate. One strategy that has come up in some of the research around congenital heart conditions is denial. And denial actually can be helpful and unhelpful. So it just depends the way you're using it. So if you, let's say, receive some not so great health news and you need some time to really process it and you don't want to think about it for a while, that's where denial can be helpful. But where it becomes unhelpful is if you are avoiding, maybe following your doctor's advice or taking care of yourself. So you really want to watch out for that. And then the T is about taking action. Once you acknowledge how you've been feeling, you evaluate your coping strategies. You want to take action and maybe push some of those unhelpful ones away and add some new ones. Next, please. So, stress. We really want to take a look at what is our baseline stress. And what does that mean? That basically means what is our level of stress on a day to day basis? It's not what's your stress level when you're dealing with a crisis or you're in some kind of a traumatic situation. It's when you're home and you're living your life. And one of the things that I like to talk to people about, we already talked about the self awareness, is really doing a body scan, figuring out how stressed am I? And I like to really put it on a scale where it's measurable. So I use a one to 10 scale, and 1 is the least amount of stress possible, and the 10 is the highest stress possible. And 1 to 3 is really when you're relaxing, you're getting ready for bed. Um, and then 4 to 6 is really what I call really the best spot to be at, because that is where you want to walk through your day. It's energizing, it's motivating, it helps you to get things done. Anything above 6 could become a little bit too much stress, and you want to really make sure not to carry that high level of stress around on a day-to-day basis. And these are just some of the ways that you can bring that baseline stress down. Really simple things that I don't know about you, but I forget about hydration. I have my water here with me. I'm always trying to hydrate more. What you put into your body, what you eat really does make a difference in how you're feeling physically and emotionally and psychologically. Physical activity. It's a tricky subject with folks with congenital heart conditions. I know I have some restrictions on what I can and cannot do. So I really encourage you to talk to your physician, talk to your cardiologist, make a plan. I've worked with some people that were immobile and couldn't really get up, but they did know and note that gentle stretching could make a really big difference. Maybe taking some chair yoga, those are some possibilities. And again, getting a good night's sleep, making sure you have some healthy sleep hygiene strategies, cutting back on alcohol, caffeine. Breathing certainly can help. Limiting social media. That is something I keep seeing more and more of. People are telling me they're addicted to their phones. They're on Instagram. They're on this. They're on that. Cut it back. That is really going to help. And again, really elevate your self care. Next, please. Emotional release. Again, we want to do a body scan, check in. How are you feeling? Believe it or not, sometimes people come in my office and say, I don't know how I'm feeling. I've just been kind of overwhelmed and busy and distracted. So, what I tell people to do is really schedule some quiet time. Get rid of the distractions. Maybe go in your bathroom and look in the mirror and just think, how am I feeling? Peel back the layers. And sometimes I hear people are afraid to know how they're feeling, but I just want to remind you that feelings are messages about what we might need to learn about how we're living our life. And we have to work with those feelings, and it can be really hard to do, but it can also be really helpful. You know that cliche, get it off your chest? I use it still because it's so true. What we hold on to, what we swallow, what we don't express comes out eventually in other ways. Um, so if you are someone who can talk about the hard stuff, find a safe space that you can talk and express yourself. I know for me in my life, there have been times when I could not talk to friends or family about my congenital heart condition. I didn't really want to make them feel bad or burden them. So I went into counseling. It was life changing for me. Some people say to me, well, I'm not really a talker. I know I have a niece like that. She's not a talker, but she expresses herself through art, drawing, Journaling is another really good way. Music, writing, all of those can be really effective. And, sometimes I'll have people come in and say to me, and they're a little embarrassed by this. Oh, God, I was crying this morning. I was just crying in my car. You know what I say to that? Wonderful. I love it when people have a good cry. And you know why? Because that hormone, the stress fight or flight hormone called cortisol, that is a hormone that pumps through our blood when we're stressed, when we're feeling depressed, when we're feeling anxious. And guess what? Researchers found that there's cortisol in tears. So when you have a good cry, you are actually reducing the amount of cortisol in your bloodstream. And guess what? They also have found it in sweat. So if you do get physical and have like a good power walk or something, and you're able to do that, the cortisol is also there, and you're reducing it. Next, please. So, tapping into the emotional and psychological pieces of who we are, I think it's really, really important to be aware of thinking patterns. How do you talk to yourself, And I can let you in on a little secret. Everyone talks to themselves. Doesn't mean that there's a problem. We all have internal dialogues. And some people will say to me, oh gosh, I never noticed my dialogue. So I'm going to encourage all of you to turn up the volume on your dialogue. What are you saying to yourself? Are you kind? Are you loving? Or are you critical? Are you calling yourself names? Some people will tell me that they're calling themselves names or they're blaming themselves. Um, and I really, really encourage you, if you identify that, we have to work on cutting that negative self talk out. And there are ways to do that. And we'll talk a little bit more about that in tonight's presentation. But we want to move from a negative conversation to a more positive, loving conversation with yourself. Some things to avoid in terms of thinking patterns that really aren't helpful is do you take things personally? Do you tend to take things personally? Quick example, let's say we went to the grocery store and we bump into an old friend and maybe she's a little standoffish. And you leave the grocery store thinking, oh my gosh, did I say something wrong? What did I do that was wrong? I must have done something. Guess what? It could have nothing to do with you. It could have everything to do with that individual. They might have just had an argument with their spouse. They might have some financial worries, and maybe they're just not in a place where they can connect. So, really, always trying to look at what the other alternative might be. Catastrophizing, another thing that you really want to try to avoid. Um, an example for that could be, let's say that you're told by your cardiologist that you need to go in for surgery. Instead of immediately jumping to the worst possible scenario, I am going to challenge you to try to incorporate some positive aspects of this situation. And some people might be thinking, what are the positive aspects? Well, maybe one of them could be, I have a strong social support. I have a strong network that's going to see me through this. I really trust my care team. I trust my ACHD doc, and the team and I have made this decision, and I'm going to trust them. Maybe it's also, you know what? Maybe I'll feel better after the surgery. So just incorporating some positive aspects instead of always just landing on a catastrophe. Avoiding all or nothing statements, another thing that you really want to try to look for in your thinking patterns. So I guess an example for this could be someone who says to themselves, well, I've had, multiple surgeries, for the last 30 years. I've been in and out of the hospital, and this is the way my life is always going to be. Well, I want to tell you, doesn't have to be so black and white, okay? Doesn't have to be all or nothing. There can be a middle ground. Yes, maybe you will be back in the hospital one day. Maybe you will need another procedure. But you know what? There might be times in between where you can connect with people that you love, that you can find meaning in your life and find joy, and always try to find that middle ground. And finally, we want to avoid comparing and despairing. And what does that mean? That means comparing the worst part of your life with the best part of someone else's life. And I'll tell you, social media feeds into this. And you really want to avoid that. You want to avoid comparing. And I think you also need to know that what you see on social media, it's usually people on vacation with smiles on their faces, but you don't see the full picture. You don't know what's really going on behind closed doors. So I just think it's an important reminder, and it's a thinking pattern that you really want to try to avoid. Next, please. So, some questions to ask yourself if you're finding that you are having some of these thinking patterns. Well, the first is really in relation to negative self-talk, right? Let's say that you misplaced your keys and have this dialogue. You're blaming yourself. You're being very critical of yourself. I would ask you to ask yourself, what would you say to a friend in this situation? Would you be that critical? Would you be judging them the way you're judging yourself? Or might you say to them, you know what? You've had a lot on your plate this week. Um, you're only human. And, maybe this is just a reminder to slow down. Do you see the difference? So that's what I want you to very gently acknowledge the negative self talk and move to a kinder place. In terms of some of these thinking patterns, I want you to ask yourself, does this thought help me feel better or worse? And clearly, if it makes you feel worse, we really want to try to move away from that thinking pattern and that thought and to find a more helpful perspective. And I'm not asking you to pull something out of the fluffy clouds that isn't true, but to land on a realistic perspective that could exist. The other question is, what is the evidence that I have that this thought is true? So when you leave that grocery store and you're thinking, oh my gosh, what did I do? I must have done something wrong. I would say to you to ask yourself, what's the evidence for that? And if you don't have any, let it go. And you know what? If you do have evidence for that, then make a plan to make amends. Maybe reach out to that person and say, hey, I'm sorry, or can we connect? Want to, touch base with you. Another question is there another perspective that could exist in this situation? And finally, I challenge everybody to think about what is the best possible scenario. So, going back to surgery, okay, you might have thought about the worst possible scenario. I want you to also balance that thinking with the best possible scenario. Maybe it's, you know what, maybe my recovery will be quicker than I think. Next, please. So, another strategy that I like to recommend to people is worry time. And that is if you're worrying so much and it's interfering in your work or it's keeping you up at night, what I say to them is take one or two times a day, set your alarm for 15 minutes, have a journal, and just worry. Go to town, worry all you can, but I want you to write down those worries. It doesn't even have to be legible. You can create stick figures if you need to, but write them all down. And then in your next worry session, you're going to take those worries and put them in two columns. One column is what you can control, one column is what you cannot control. And then you're going to go through something like this worry tree. If you find that you can control it or do something about these particular worries in this column, you're going to make an action plan. You're going to figure out what, when, and how. Then you're going to move to just doing it. You need to just get it done, plan it, schedule it, do it, and then let it go. Focus your attention on letting it go, knowing that you've done everything you can do to better your situation. And if there are things that you can't do anything about, then we're going to also work on letting the worry go, but we're going to meditate or find a distraction to change your focus of attention. And that could be also through like breathing, meditation, talking to somebody, expressing how you're feeling, and really working hard on letting that go. Next, please. So I'm going to move on now to that social piece of what we all have that we carry with us throughout the day. And before I talk about strengthening social relationships, it's really important to know that the most important relationship that we have isn't with our parents, isn't with our partners or our children or our friends. It's with yourself. Next, please. And I really want everyone to think about, how do I feel about myself? Again, we're doing another body scan. We're quieting the distraction and we're really tapping into, um, am I being compassionate enough with myself? What does my self esteem look like? Because self compassion and self esteem can be really connected. So, ways to work on those two things, these are just a few of the ways. um, Communication, learning how to communicate assertively, not passively, not passive aggressively, and certainly not aggressively, right? We want to find a way to be kind, clear, but direct. That's being assertive. A lot of people have hard time doing that. A lot of women that I speak to said, well, I grew up to be a good girl. I know I was always be good and don't rock the boat, don't cause conflict. You know what? Sometimes we need to assert ourselves. Sometimes we need to say no. Sometimes we need to set boundaries for ourselves. That is a healthy thing to do. And that really helps us with our relationship with ourself. We have to stop looking for validation from other people and start looking inward for that validation, giving yourself permission to identify your strengths, recognizing everything you've been through and what, where you are today. And also, one thing I noticed, people have a hard time sometimes learning to accept compliments. Take that compliment and just really hold it, inside and really internalize those compliments. It's a really important thing to do, not only for yourself, but also, you're not going to have strong relationships with other people unless you have that strong relationship with yourself. Next, please. So support system. So it has been found that positive support system can literally shield us from developing mental health issues, can also help our physical health. In fact, you all may have heard, I don't know if you've heard or not, but that loneliness is now as dangerous as smoking 15 cigarettes a day. So we really want to evaluate, how are we doing in that aspect of our life? Do we have positive support people in our lives? Um, are you spending time with people that you like? Believe it or not, I hear often, oh gosh, I'm going to need to have coffee with this person. I don't really like this person, but I'm going to, see them. So, you know what? I think it's important to just figure out who's supportive, who do you have commonalities with, who do you actually like? Rethinking toxic relationships, relationships that um, may overstep your boundaries, might not respect your boundaries and limits. Um, and I think it's also really important to remember that we all have an active role in the relationships in our lives. So we can't just sit back and isolate and expect people to come to us. We need to reach out. We need to maybe make some phone calls to old friends, or, be a good friend when we can, when we're feeling well, when we're feeling like we're able to. So it needs to be a reciprocal relationship. Again, watching out for isolation, learning to ask for help, super important. A lot of people tell me, well, I can't really ask for help. I feel funny. Don't feel funny. In fact, I can tell you this, asking for help can actually strengthen those relationships because one day those friends are going to remember that and they may come to you when they need a friend. So I would, think about that. And also, if you're feeling like you don't really have a lot of positive people in your life, go out, join a club, volunteer, join a meetup, find people that you have commonalities with. Next, please. There's also peer support. Very important and can be very, very helpful. Of course, I'm going to shout out ACHA's peer mentorship program. It's a program I've been involved with and I'm still involved with now for almost 15 years. All of our mentors are trained and we match you with other individuals with a congenital heart condition. Um, and you can be connected on Zoom, phone, or email. There's also online support groups that can be really specific according to gender or CHD. You got to be careful because sometimes there's some medical advice thrown around. I always say, take what you need, leave the rest. And also, you can ask your center, your ACHD center, if they have any kind of support group that you can join. And if they don't, ask them to start one. Next, please. Developing patient expertise, another very important strategy when you're dealing with any kind of chronic illness. You want to really become a partner with your medical team. You want to have a voice. You want to be able to speak up and educate yourself about your condition, but do it at a comfortable pace. I don't want you to take it all on at once if you're not comfortable doing so. Go at your own pace. Always be prepared for appointments. Bring a piece of paper, pencil to take notes. Maybe bring someone with you if you have someone that you trust and is able to go. Bring a prepared list of questions. And always make sure that you have your team's best contacts in case you have other questions or emergencies. And of course, involve someone in your care if possible. Next, please. I love this quote, and I want you all to remember this, that in times of crisis, people reach for meaning. Meaning is our strength, our survival, and our survival may depend on seeking and finding it. Next, please. So I want you to ask yourself, what is your meaning? What is your life's meaning? Everyone's different, right? So how to find that? Ask yourself, what are your values? Maybe re-examine some life priorities. Figure out what brings you joy. And believe it or not, sometimes people say to me, I don't know, I've been so distracted. And I say, think back to a time in your life when you were happy, when you felt connected. And, I know for me, I feel most connected when I'm with other people that I care about, when I'm with my beloved pets, when I'm outdoors, when I have the sunshine. Those are all aspects that I try to integrate in my life as much as possible. And I encourage you to figure out what aspects bring you joy and what your priorities are. And to really try to focus not on what you can't do physically, but what you can do. That is really important. Some people are different learners. Some people are visual learners. I know I love to cut out photos and I have quotes and photos hanging around my house. There have been a few um, days where I've gotten some friends together or family together and we've made vision boards for a year ahead, get a bunch of magazines and just cut out what inspires you. What are some of your goals and hang it up where you can see it, where you can be reminded. And again, set meaningful, um, goals that are measurable and that are realistic. And I think, it's always really important to remind yourself that your illness does not define you. For instance, I have a serious congenital heart condition, but I also am a wife, a writer, a counselor, a mother, a friend. And that's what defines me. All of that defines me. And I encourage you to find the other parts of yourself that define your identity. Next, please. Some good news. Some of the research has found that many individuals with congenital heart conditions are thriving in many ways, and that many have been found to be resilient. Resilient is the ability to bounce back from a traumatic or difficult experience. And a lot of them have reported post traumatic growth. A lot of the people that I've worked with have shared with me that they have clearer priorities in life, deeper sense of empathy for other people now that they've gone through that, maybe a deeper appreciation for life, maybe more meaningful relationships. I know people have shared that, having gone through a health crisis, you really learn who's there for you, right? And that really can deepen those relationships. Next, please. So I have to just go over some red flags for people since I did touch upon mental health. If any of these, you experience any of these, I would suggest that you reach out for some professional help. Prolonged feelings of sadness and or anger or anxiety every day for 14 days or more. Insomnia, any kind of ongoing insomnia, sleep is very important to your health and mental health. Isolation, let's say that you're not really seeing friends, you're not really feeling like reaching out or going out. Again, the anxiety, maybe you don't enjoy what you used to enjoy. Maybe you're finding it's difficult to adhere to your doctor's orders. Or, of course, if you're having any thoughts of suicide, you really want to reach out for some professional help right away. Next, please. People often say to me, Tracy, how do I find a therapist? It's so overwhelming. And, I agree, it can be really hard. And one of the biggest things that I've read about in the literature is the most important thing in a therapist is the chemistry between you and that individual. So certainly you want them to be credentialed, but the chemistry needs to be there. And the way to find someone good, I always say word of mouth is important. So maybe asking a friend. Now, if it's your best friend that you're going to complain about, you don't want to have the same therapist. But if it's an acquaintance or a colleague that you're not really going to talk about, you can get a name from them. Maybe ask your primary care physician, maybe ask your ACHD doc for some referrals. Sometimes religious institutions have lists of people that they can refer you to. You can call your insurance provider. Believe it or not, sometimes you can find a clinical training institute, postgraduate training institute, if you live near a big city, and they're looking for people for their postgraduate trainees. And you can usually get a sliding scale with those situations. There's Psychology Today, and of course, there are the crisis numbers that you can access as well if you need to. Next, please. I would be remiss if I didn't mention the book, which a lot of my presentation has come from. And it truly is the book that I always needed and could never find. I remember scouring the libraries and the bookstores looking for any book on a young adult who grew up with a congenital heart condition, and I couldn't find it. So my writing partner and I wrote this book, Healing Hearts and Minds. Next, please. And that's it, really. I thank you all very much. And I would like to open up the floor whenever Carl is ready for any questions you might have.
Thank you so much, Tracy, for that
You're welcome.
helpful, timely, and informative webinar. So we are going to dive into questions and answers now. As a friendly reminder, you can send through the Q&A folder on your control panel. We do ask that you keep your questions general, and any questions specific to your diagnosis or treatment be referred back to your ACHD team. All right, so let's get started. We have one in the chat. Tracy, how old are most of your patients?
At this point, I'm only seeing adults. So I don't see anyone under the age of 18 anymore. And I have a wide variety of ages, quite frankly.
Thank you.
You're welcome.
Tracy, in your book, you had described a spa day, a brain spa day to be specific. Can you speak to how a brain spa day looks like and how that might help us cope?
Yeah, I love that term. Um, and really what that's about is quieting the noise, scheduling time to just get away from distractions, whatever that might be, whether it's work, family, um, and maybe going outside. There is something about getting sunlight on your forehead that really can stimulate you cognitively and can really help with your overall mental health. So I would schedule downtime to just be, to just walk or sit on your porch and just have some quiet time. Give your brain a break.
I love that. Thank you. We have another question. I have been numb since my fifth open heart surgery in 2024. I'm 63 years old. Is this common?
It can be a reaction to trauma for sure. Some people experience the fight or flight reaction, and some people freeze and feel numb. So I would recommend maybe seeking some outside support for that for sure, because oftentimes that can be a sign that you've gone through. I mean, 5 open heart surgeries, you've been through a lot. And there might be a lot that you want to talk about and to process.
Thank you, Tracy. Our next question is from a 30-year-old who was diagnosed with tetralogy of Fallot. Um, she's been through an awful lot, and she's been more and more curious about PTSD as a result of the medical trauma as an infant. She doesn't see any outside factors in her life, but she does notice impacts of trauma on emotional processing. Do you have any ideas or places to look for her?
Yeah, well, that is something that we're finding that PTSD is and can be a response to not just, years ago it was they talked about military trauma, but there's also the medical trauma that we go through that absolutely can create that. And finding a good therapist that has experience with trauma-informed care would be my recommendation for that. And I would also maybe consult with your ACHD center as well about, maybe they have someone that they can recommend within their center that has that experience. The other thing I want to speak to, and I had a slide on this, which I removed because I didn't have the time. I could go on for hours about this topic, but I won't because I have limited time. But you know, when we go into the hospital, if you ever need to go back in and you have any kind of medically related trauma, tell them, let your cardiologist know, let the hospital staff know, and let them know what triggers you. Because with PTSD, there might be certain smells or sounds that trigger you. And you want to identify them and let your healthcare team know what they are. But really trying to find someone with that trauma-informed care experience is super important.
Tracy. Our next question, what are your thoughts on somatic therapy for processing our experiences as ACHD patients?
I think it's great. I think it's great. I think trauma definitely does live within us. There are physiological things going on in your body with your central nervous system when you're feeling stress and when you're feeling that trauma. And I think that can be super helpful.
Thank you. There's a comment thanking you for referring to CHD as a congenital heart condition. Um, Thought I'd share that feedback with the
That
members.
is my goal. That is my goal to have everyone call it a condition and say CHC, but it's been a little challenging. Thank you for that.
Um, let's take another question. Are you aware of any psychological evidence that connects ACHD and the nervous system, which may impact mental health?
Yeah, I mean, there is this therapeutic model, the polyvagal theory, which they are doing some work on trauma and that central nervous system. I know my writing partner has written about this, and we do have some information about that in our book as well. But there definitely has been research around this.
Thank you for sharing. And we have another comment saying that they've bought numerous books of yours and give them to people. And so just want to share some appreciation for copies of your
Oh,
book.
thank you. I'm so glad you find it helpful.
Um, let's take another question. Um, can you speak to healing PTSD when there is recurring trauma due to our CHDs?
Yeah. That's hard. It is hard because there are sometimes frequent hospitalizations that come very suddenly. Um, and I think that for something like that, again, going back to finding a good therapist that is trained in trauma-informed therapy would be helpful. And really learning how to, you know, tap into some stress reduction exercises, some somatic exercises to help your body relax. Because I always say to people, we can't be mindful, we can't be more relaxed and feel more secure and safe unless our body is more relaxed. So you want to really work with someone on some of those, maybe some, you know, breathing exercises or other types of exercises that really do downshift your central nervous system and to really help you to feel safer.
Thank you for that, Tracy. Um, our next question, you had mentioned connecting with others with ACHD through email, phone, etc. I believe this is referring to the peer support program. Can you tell them how they can take part in that?
Oh, sure. Yeah. Go on ACHA's website, and there is a link for the peer mentorship program. And in that link, there is an application, or you can just email Carla with any questions that you might have. We now have just about 50 volunteers all around the country. It's a pretty diverse group of individuals, all ages, different diagnoses, and you know, any questions that you might have can be answered on their website, or if you continue to have other questions, you can email Carla. And there is an application online too.
Thank you, Tracy. And you can email me at info@achaheart.org and I will get back to you. All right. Our next question, have you noticed ACHD patients struggling with their capacity to work full-time later in life? And can you speak to how we can cope with that?
Um, so a resurgence of symptoms, is that the question?
Yes, I believe that's what she's speaking to.
Yeah, well, I think that it's hard. It is hard, and it can sometimes bring us back to earlier days if you had previous surgery. So I think it's really important to try to ground yourself in the present and to find a team that you absolutely trust. Um, make sure that they are an adult congenital heart specialist and hopefully accredited as well. Um, and really become a member of that team and have a voice and have an understanding of what's happening, and make sure that you feel like you have a voice in the treatment that they are recommending, and you know what your options are. um, that can really help to give you more of a sense of control, which then helps you to reduce any kind of likelihood later on of developing some significant mental health issues and to talk to someone about it. It's hard, let's face it. Hearing bad news is not something that, um, we want to hear. So I think you need to talk about it. You need to get a strong support system around you and work together with your team.
Thank you, Tracy. Our next question, would you recommend therapy even though someone's condition may not be improving? So,
I'm going to assume the question is if your mental health situation isn't improving and you're already in therapy. That's what I'm assuming
yeah,
might be. And I would say try another therapist, right? Even if you like your therapist, sometimes you need to change it up a little bit. But I do suggest to people, and this is hard to do, but when people have done it, they've come back and told me often that it was helpful, is to talk to your therapist about it. Say, look, I've been in therapy with you now for a year. I don't really know that it's working. Um, I'm wondering if you could do this and that, maybe be a little more directive, or I'd like a little bit more of this kind of support. If that individual is unable to do that with you, or you're really not feeling comfortable, find another therapist.
thank you for that. Um, can you speak to ketamine therapy to battle depression? Is that something that you're familiar with? And if so, can you speak to if you feel it's helpful for CHD patients?
So I've never worked with a CHD person that has received ketamine therapy. There's a lot of research out there on it, and from what I've read, it can be helpful for treatment-resistant depression. So that means that you have depression, clinical depression, and you've tried all these other treatments. You've tried therapy, you've tried physical activity in a safe way. You've tried medication, you've tried a few different medications, and nothing has worked. So it's really for that treatment resistant depression. I'm not sure about any cardiac effects, but that's something to ask your ACHD specialist.
Thank you so much for sharing. And this is going to be our last question of the evening. Can you just speak to the difference between anxiety and PTSD?
Sure, yeah. So anxiety, if you have PTSD, there is anxiety involved, right? You're going to feel anxious. And some of the signs could possibly be flashbacks. Maybe you hear a noise and you're immediately remembering a traumatic situation in the hospital, or maybe you smell something and it reminds you of something that happened to you that was very traumatic. Maybe you're having difficulty sleeping or you're having nightmares. Nightmares and dreaming are the way your brain's processing the trauma. So that's another sign that might be happening. But really, that trigger response, there's a startle response sometimes with PTSD, where if, again, you hear something or, smell something, you jump, you have like a startle type of a feeling. That's another indication that it might be PTSD. But really, again, you want to go to a trauma-informed therapist, and they can really help differentiate between the two.
Well, thank you for describing the differences for us, Tracy, between anxiety and PTSD. Um, I'd just like to ask you if you have any final thoughts that you'd like to leave us with tonight.
Um, I just want everyone to really give yourself the space to just acknowledge everything you've been through. I mean, a lot of us, including myself, have been through a lot. Give yourself credit for that, and I really encourage you, please don't define yourself by your condition. Go out, find joy, find things that are meaningful to you, that you can still do and engage in. Not focusing on what you can't do, but what you can do. And like I said, really being compassionate and working on a lot of those unhelpful thinking patterns.
Thank you, Tracy. This was such a helpful webinar, and thank you all so much for all of your questions. And this does conclude our webinar. I'd like to remind everyone that it was recorded and will be available on our website later this week. Thank you again, Tracy, for taking the time to talk to us tonight about coping skills to live well with CHD.
Thank you for having me. It's been my pleasure.
Oh, it's a delight to have you on. Thank you so much. And we also want to thank our sponsors again, Abiomed and Johnson for their support of tonight's webinar through an unrestricted educational grant. An evaluation will pop up in a separate window on your browser after the webinar closes. It will also be included in the email you receive tomorrow. Thank you in advance for helping us improve our webinars. We appreciate the time you take to fill that out. A few final thoughts. If you would like to talk to a person with congenital heart disease or a loved one of a CHD patient, or if you have questions or concerns that one of ACHA's heart-to-heart peer mentors can help you with, please email info@achaheart.org and someone will contact you. If you need to find an ACHD program, visit the ACHA clinic directory available on our website. We hope you will be able to join us for our upcoming webinar, Taking the Next Step, Transitions and Transfers of Your CHD Care, presented by Tara Shores and Nicole Antonville on Wednesday, May 28th at 7 p.m. We also hope you will join us for our Spring Walk for 1 in 100 season. The 2025 Walk for 1 in 100 series kicks off in April with walks in Nashville, Tennessee, Jacksonville, Florida, Austin, Texas, Houston, Texas, and Omaha, Nebraska. A list of other Walk for 1 in 100 locations is available on ACHA's website. Thanks again for registering for tonight's webinar. We hope you enjoyed it. If you did, please consider making a donation so that we can continue to bring you great educational resources and information. And thank you all and good night.